Well, good evening, everyone. I'd like to welcome you to our Fireside Chat in Round Lake Beach. I'm Mayor Rich Hill. Today our guest is Bruce Johnson, Executive Director of Nicasa. Bruce, welcome to Round Lake Beach.
Thank you very much for having me. This is fantastic.
I'm glad you're able to make it out. You've done a lot with Nicasa. You also used to be the Chief of Police in Round Lake Park, so you know us very, very well out here. And can you maybe give us a little background on your history and work and so forth?
Sure. I think if you add it all up, I should be about 104 because I spent about 28 and a half years in the Marine Corps, the Marine Corps Reserve. I've been at Nicasa for 13, and I was in law enforcement for 22. And I've been teaching for about 26 years. Wow. So like I say, add it together, I've got and I look at it also. I know I look over 100 as well.
Well, again, we appreciate you taking time out to visit us here today. And we're also very lucky to have the teen court students here today. Welcome. Thank you very much for showing up. And
Yay.
maybe each quickly let us know your name and anything else you care to share. Use the microphone.
I'm Grace. I'm a senior at Lakes Community High School.
I'm Riley. I'm a senior at Warren Township High School.
I'm Jessica. I'm a junior at Warren Township High School.
I'm Rachel. I'm a junior at Grays Lake North High School.
Great, thank you. Now, again, we appreciate your stop coming out tonight and help us with the questioning. Anything else before they begin?
I don't know, I'm a little afraid of the grilling here, 4 against 1. All right, thank you. She said we'll be nice, so I appreciate that.
Well, who's got the first question?
What does Nicasa stand for, and does it mean something?
So that question is an interesting one. So Nicasa used to stand for Northern Illinois Council on Alcoholism and Substance Abuse. And what we found is that it was a long statement that didn't really describe what we did. So we've shortened it to Nicasa Behavioral Health Services so that it gives you an indication that we're a true behavioral health service agency. So we have substance abuse, mental health, and then wraparound services for the clients we see. But we've actually had a number of name changes over the years, and this is the one we're sticking with. Thank you.
Does sound a lot easier to remember.
Yeah. And I also get is it Nicasa or Nicasa? And however you want to call us, as long as we can help.
How did Nicasa start and what was its purpose?
So Nicasa is as grassroots of an agency as you could get. So in the 1960s, there were really not a lot of services for alcohol and substance abuse, not just in Lake County, but nationwide. So in 1966, kind of at the urging of the recovery community, Nicasa started with one staff member. And that one staff member used to take individuals from Lake County to Elgin for detox. And that was the beginning of Nicasa. So as the field and the country and Lake County started to look at alcohol and substance abuse and its effect on our youth, on adults, as well as our families, Nicasa tried to be that agency and became that agency to meet the needs within the community. So starting with one staff member, we started to grow. And in 1970, we were the first agency to have specific Latino services for the community. And then in 1972, we opened up a residential halfway house for 20 men and women. So that house is really significant for the almost 5,000 people that have come through Bridge House. That's the name of it. And it's a residential facility, and we usually have clients there from somewhere around 4 months, sometimes as long as 6 months, and they often come to us from a drug court, mental health court, a residential program, and then we're able to help them to stabilize their lives so that they can remain drug-free, substance-free, and in recovery. And then we continue to expand, and as you may know today, we have 8 locations throughout Lake County. So we are covered north, south, east, and west, and we have about 100 staff. So in that 50, almost 2 years, we've grown from 1 staff member to 100. And our services have really gotten very broad to meet the needs of the community. But it's a good story because it's an agency that responds to the needs of the communities and the county as a whole. And as those needs change, Nicasa changes. So we're one of those agencies that often doesn't tell people what we actually do. We ask them what they need us to do. And we've got really talented, dedicated staff that can meet their needs. So the field that we're in constantly evolves. There's so many new trends that probably everybody's familiar with, and I'm certain these young ladies are familiar with. Times are changing, and agencies like Nicasa have to change as well and meet the needs of the communities and the clients we serve. So I love the story because you could just go back in time and one person, now 100, and in a perfect world, we'd expand to other levels of care and be able to help even more. So.
It's a shame there's so much need out there, but I'm glad there's somebody to help them. And I guess I'd rather see treatment rather than incarceration for a lot of these people.
Correct. And Mayor, I think that's key. So, and I think in a lot of our work, and I know we're going to focus a little bit on teen court, but if you think about the individuals that are in jail and prison, and those that are there because of a mental illness or substance use problem, they need help. They don't need to be in jail or incarcerated. It's a lot less expensive to have somebody help them and to keep their families whole and to work with their families than to put them in jail and actually cause more problems for them and their families. So I think, we'll talk about teen court, but I think teen court is one of those, law enforcement assisted diversion programs for adolescents. So it's a way of how do we not put somebody in the system and get them the help that they need before they end up in a jail or prison. And I think that's got to be a big focus for us. And I think there's a lot of cooperation and partnerships that are going on through treatment providers like Nicasa and, for example, the Way Out program, which is huge. And that is a law enforcement assisted diversion program. Somebody needs help, they come into the police department, they come in the Round Lake Beach Police Department, and they say, I need a way out, I need help, and they get the help before something tragic happens. And I think more, there's got to be more thought to those kinds of diversion programs so we're not putting people in jail and prison. And don't get me wrong, I was in law enforcement. There are some people that, that's an understanding. We have to keep our community safe, and we have to make sure, people aren't victimized. But at the same time, we've got to, treat people that need treatment. I think it was not too long ago that a statement was, said that, the largest mental health provider in the country is Cook County Jail. So if you think about that, and you think about how mental health and substance abuse go together and the co-occurring disorder that is there, and I would say a good estimate is about 75% of our clients struggle with mental health and substance abuse. So if you think about these individuals in Cook County Jail, when you think about the resources that are expended on them in a setting of a jail, is that really where many of them need to be? And I think as you saw years ago when we started to close the mental health hospitals, and we didn't really understand that this is mental health, has a stigma to it. And many people that struggle don't go and find help and find somebody to assist them. And what ends up happening is often they're self-medicating, they're using substances and alcohol, and now you've compounded the situation. So I agree with what you said is on the front end, if we can help them and divert them from the jail system and the criminal justice system, that's going to be much better for our families, for our communities, for our county, and certainly for the state and the country. So we just have to do it differently, and we have to look at our young people, like these four, young ladies here, if they're struggling with anxiety, depression, unfortunately we see a lot of kids with suicide ideation. There's a lot of pressure and stress on kids today. How do they get help? How do they reach out to get help? We have a text-to-tip in Lake County, so they can text and get connected to a licensed counselor, and then there's got to be follow-up at another. But that is, we've got to change the perception. I'm really proud that Nicasa is seeing many more Hispanic clients for mental health, and that's not a norm. So the relationships that we have built with the community and our care and concern for the community, I think, is part of why that's happening. But that's significant. Got to change the stigma. Got to change the culture. People need help. They need to get help. You get help for your physical ailments. You get help for your diabetes. You get help for your cancer. You need to get help for substance use and mental health as well. We just need to see it differently than we do now. It's not a weakness. It's not something that should be, put into a compartment and forgotten about. There's really help out there. We just have to get them to come.
Next question, please.
Can you tell us what services Nicasa offers?
Yeah, so I like to say we have a full continuum of services. So we do prevention programming, which Teen Court is a part of, but we also do programming in school and after school. So we've been in the Round Lake schools for over 20 years providing services to help with academic success, enrichment opportunities, and really helping individuals that are probably at risk for poor decisions and those that are at risk for activities that we don't want an adolescent to get involved in. So having these programs during the hours of 3 and 6, when I think and having 3 kids, I should say that, 26, 23, and 17, so I'm still worried about the 17-year-old. But knowing that that's the time when kids get into trouble. So having a program where somebody is caring for, watching those kids, helping those kids, academic success, we have teachers from the school and our own staff that help them with their homework, help them to achieve. I had one parent here in Round Lake say to me, it's such a pleasure when my child comes home from your program because their homework is done, they've studied for whatever exams they have, and they can actually enjoy their child, not fight with them. Yeah, and not fight with them to get their homework done, which we all do. So we have these prevention programs, which I think are significant. We're also in the Waukegan schools. And then we do programming in schools as well. We recently taught an entire district a module on suicide awareness and signs. And maybe I'll share this because it's significant. So we saw many hundreds of kids, and out of each 100, about 20%, so 20 out of 100, either themselves needed to talk to somebody about suicide or knew somebody that they needed to talk to. That I thought was significant, and I thought, wow.
It's a high number.
It is, and there was actually a middle schooler who recognized signs in somebody and actually told somebody after our module was completed, and I think that young person actually saved somebody. So it's significant. It just means we have to talk more about it. We have to recognize it. I think we have to screen for it. Again, go to school, you have to have your shots, you got to have your immunizations, you got to be healthy, you want to participate in sports, you got to be physically able to do that. How do we look at mental health? How do we look at depression, anxiety, and stress, and all those things? And how do we care for our kids on the front end rather than over time when it becomes a really big issue for them? So I think, and then we do early intervention, which is what I would say Teen Court could also be characterized as. And then we do treatment. So we see about 6,000 treatment clients a year for substance abuse and mental health, which I think it's pretty significant. That's a large number. We're only one provider of a number in the county. And then we do recovery services as well. So we have peer support specialists, we have recovery coaches, and they help those individuals stay in recovery so they don't relapse. I heard a very smart doctor give a definition of addiction, and he called it a chronic relapsing brain disease. So it means it's going to happen. That's part of the disease. If we can help these individuals stay in recovery, we can keep them connected, we can provide them resources, they don't necessarily go back to the environment they came from where they have all these triggers to use again, we have a much better likelihood of keeping them in recovery and out of the criminal justice systems, but also keeping them alive. And we work very closely with the court system. So a vast majority of our clients have involvement in the criminal justice system. That's why it's a passion for me and for, I think, many others to try to figure out, how do we help people before they get involved with the police, with the jail, with probation, not seeing a judge. How do we intercept them before that happens? And we're involved in our therapeutic intensive monitoring courts in Lake County, which are drug court, mental health court, and veterans court, which are, if I would tell anybody, if they got a chance to actually go to drug court, mental health court, or veterans court, one, it's impactful. Judge Stride, Judge Bishop, and really the whole team does a great job of caring for these individuals that are struggling. Some of them may have been to prison multiple times, but they're asked, and if they take advantage of it, it's a long program, sometimes up to 30 months, and it's not easy. Sometimes it's easier for some people think it's easier to go to jail, go to prison. In this case, though, I've seen it countless times. Individuals are truly helped through that long period of time with lots of wraparound services, with a whole team caring for them, with judges that are unbelievable, compassionate, yet kind of strict on what they have to do. And they get to the end, and it's tears. Police chiefs show up, and this I think is interesting for people to understand. So the individual that got arrested in this case is participating in drug court or mental health court or veterans court. A police officer put him there. And you would think that the individual would be angry at the police officer, angry at the police department. Every single time it's quite the opposite. They're thankful to the police officers, thankful to the department, and the chiefs show up. Round Lake Beach's Gil Rivera shows up, and he's there at the graduations, and they literally take the police chief up there, and that's the first handshake that these individuals, pretty much make. Because they were the impetus, what intercepted them to help them. And I think we have to see, not just because I'm former law enforcement, but we have to see law enforcement in that way. We're trying to do what's best for the safety of the public. In this case, you're arresting somebody for substances, alcohol, whatever their issues are. Okay, it's not just about, putting them in the process. It's about, okay, how do we help them and stop them from coming back to the jail over and over and over again? So we also do program in the jail, substance abuse as well as anger management. So we have a very good relationship with probation, with the jail. The health department is a huge, asset for us as well, the Lake County Health Department. So. But we try to do as much as we can. I would say, we obviously don't have every level of care. So I only have a residential halfway house. I don't have residential treatment. And in a perfect world, I'd be able to have another house where if you left Bridge House, our halfway house, you would go somewhere else, like a 3/4 house. And the longer we have you in that setting, the more potential you have is to have a positive outcome and stay in recovery. So the longer you have somebody, the better their chance is. So I think there's some of those things that our county is really looking at, and how do we provide more of those services as well. But we probably see, I would say, with prevention programming, treatment, and all, there's probably 10,000 plus people we touch a year in our programs.
So they're kind of like the old saying, developing a habit. If you do it the same thing for 30 days in a row, you kind of develop a habit for it.
Exactly.
So the houses.
And the structure is necessary. Just what you said. It's oftentimes, we have individuals that come to us that, they've never made their bed in their life. They haven't cooked a meal. And we get these individuals, we work on a budget with them. We get them employed. So that they're becoming productive members of society.
Yeah.
And that's I think the goal. That's how, you provide those things, and there's a lot of needs that these individuals have. But if you can provide those, your chances of keeping them from recidivating are much, much greater. So, but structure is an important part of that. So, there's some programs that literally every minute's accounted for. So. Because it's what's needed. So we meet clients where they are at whatever they need. So it's one program doesn't fit all. And especially with the younger population that we see, they may have many incidences of treatment. So they've been to treatment many times. Sometimes you have to do things differently. So we do complementary therapies. We do art therapy. Which, it's wonderful because the clients can express themselves through art. Even many clients that, like me, couldn't draw a stick figure, but they're actually able to do it. And it really helps them, and it helps them then express what they're going through. And that's like the beginning part of how they get help. So I think, we do acupuncture and acupressure. We do diet and nutrition because that's a big thing. It really has to be the whole health, and we rely on our primary health care providers as well. And the Lake County Health Department is probably the biggest one, but Erie and others as well, Vista and everybody, because you have to think about whole health. It's not just mental health, it's not just substance abuse, it's not just primary care. It's how do you, integrate all of that together to get your best outcomes. So, if you're not eating properly, and if you're eating the wrong things, that has an effect on your outcome in treatment. So yeah, it's something that we had somebody actually in Round Lake today, a nutritionist that was working with a group, and sometimes she brings in smoothie making stuff, and she's done that in the schools in the after school program too. But we're integrate yoga and whatever you can do to help people, and there's no magic wand in this, so everybody's different and they respond differently, so you have to really try to do the best you can for each individual.
Next question, please.
How do you fund your programs?
Oh, one of my favorite questions. So we're a not-for-profit. We're a 501c3, and one of the oldest ones in the county, so we've been around for a long time. And we do receive federal and state funding. We write a lot of grants and try to also write those grants so we can bring new services and new ideas into Lake County. So we do that. We have contracts with the state of Illinois. So we have a contract to provide services. So that's how we fund our programs. But then additionally, we have corporate sponsors and donors that help us a lot. We have individual sponsors and donors, and then we have foundations that help us as well. And I have to say, the Healthcare Foundation in Northern Lake County is a great example of a foundation that sees the kind of the bigger picture of those individuals in the county that are not able to access services and how to then help them out. And one great example is that in some terms, the Round Lake area is, I don't want to call it a desert, but it's a little bit of a desert for behavioral health care. So about 6 years ago, we were in a discussion with the Healthcare Foundation, and we knew that we would like to provide mental health services in the Round Lake area. Definitely needed. There weren't, there aren't providers like there are in the southeast of the county.
Right.
And the Healthcare Foundation actually helped us to fund and start our services. So many people owe their health literally to the Healthcare Foundation of Northern Lake County. And it's those kinds of foundations that help us. In fact, Walmart helped us with our nutrition program. And they helped us, really further that for our kids in the Round Lake schools.
Nice.
So foundations are a huge part of what we do. Some remain anonymous. But I think in the country, the statistics that I always hear is that if you include planned giving, individual contributions are something like 80+% of all donations and contributions given to not-for-profits.
Wow.
So what that means to me is that, it's not that the government in this case, always takes care of the needs. It's not that corporations, they do a great job. We have wonderful corporations that help us. It's not just foundations, but the majority are individuals just like you and me that believe in a cause, believe in a need, have a family member or friend or neighbor that's touched, in this case, by substance abuse or mental health. And let's be honest, it touches all of us. Yeah. There's somebody that each one of us knows. Sometimes, unfortunately, there's tragic, circumstances that people are made aware of the problem. But it affects everybody in the county. It doesn't, there's no socioeconomic, stoppage to substance abuse and mental health. So it's something that, in this case, it's important. Prevention is important. Programs that we have are important, and a majority are funded literally by individuals just like all of us. And actually, young people are playing a very large part in being philanthropic. So it's nice to see that generations also get it. And there's sometimes they won't donate as much, but more of them may donate. Mm-hmm. So I think that's important, and it's important to know that it's in our thinking about our communities and our society. Lake County in our case, because I think about it in a county perspective. We care for each other. So there are needs, there are gaps. How do we fill those gaps? How do we help individuals? How do we see the bigger picture so they don't go to jail and prison? How do we keep the families together? How do we provide resources that the state, the federal government can't provide? So I think that's where not-for-profits really fit into a niche that helps so many where in reality that's not maybe the function of government.
Great.
So.
Next question, please.
Who does Nicasa partner with in the community?
Ooh, that's a long list. So, literally, I would say we have an annual report on our website, and I would say there's probably 150 plus entities that we partner with, and that includes other not-for-profits. So there's a lot of times where we're going to do something, or another not-for-profit is going to do something, or even the Lake County Health Department is going to do something, or the Sheriff's Department, or probation, and there's an initiative they want to do. Well, the goal in Lake County, which has always been wonderful, is we bring all the people to the table and figure out who's best to do what, and how we can make it a success. And so we partner with school districts, obviously. We partner with our first responders, law enforcement, especially for teen court and some of the diversion programs. The Regional Office of Education, the townships are amazing. So we have a partnership with the townships, who also are donors to us as well, and the county goes into that category too. So how do you collaborate? How do you have referral agreements with all of these other entities? Because I don't do what Mano a Mano does, and Mano a Mano doesn't do what Nicasa does. Mm-hmm. So the key here is how do you catch individuals that need help, and if they need some services you don't provide, how do we then connect them to these other entities? And there's Lake County is wonderful in that regard because we have a lot of resources, we have a lot of wonderful organizations, not-for-profits, and entities that really understand that. I can give you a whole bunch of examples. We have a family advocacy program where somebody can come to us for pretty much any need that they have if they have a child under 18. And from employment to emergency utility to we can find resources. It's not necessarily Nicasa that's providing it, but we have a counselor that works with them to say, what do you need and how can we help you? So if you're homeless, you're in your car and you're struggling, how can an agency help you? And if that's Nicasa, we can catch you in our family advocacy program, and then we can refer you to other agencies that can help as well. And again, we get assistance from municipalities, townships, the county, many other foundations that help with that. They do wonderful work, but somebody has to catch them. So I think the goal of, for Lake County is no wrong door. You come into a place for help, whether that's the police department, the village, or a not-for-profit, how do we get that person the help? And so I think that's a key component for Lake County. And I've after working and being here for 25 plus years, I came from Cook County, and I'm not going to say anything disparaging about Cook County, but this is a county where if you want to start something, you could literally get every municipality, every police department, the unincorporated areas to do something. It's amazing. We've pushed legislation from this county, from social host ordinances, and the list goes on. We've made a difference, and it's because of the strength that we have. So in that regard, I feel blessed that we have all these people that care so much and collaborate their gifts and skills and talents and to accomplish an end. So I sound a little bit like a cheerleader, but it's because I am. I've just seen things done that other counties can't do, and I think that's because of the people here.
We've talked many times about this, the cooperation and working together. You can get so much more done than if you all try to do it independently, a little here, a little bit there.
Exactly.
Get together and wow, it's amazing.
Yeah, and you leave the some of the issues aside and look at what the real need is, and then accomplish that need. And what I love also, because I'm a cheerleader for the Round Lake area too, is that I came here 25 or so years ago. I think maybe about 25. And what I loved about the Round Lake area is nobody put their head in the sand. Nobody said, hey, we don't have an issue, or we don't have this problem. You bring people together and you go, okay, how do we solve the problem? And whether that was BEST, whether that's Exchange Club, any of these entities that have just brought people together to one table and said, what can we do for our kids? What can we do to stem this problem? And I think that's for me, that's the key, and I think that's a strength of Nicasa. In fact, it's the reason I left law enforcement to go to Nicasa. I got kind of recruited away, and I really went there because I met the staff. I knew some of the staff. I was actually thoroughly impressed by everybody I met. Big picture, smart, people that are trying to help, and it just. That's really, honestly, that's the reason why I left law enforcement, because I loved, policing. But to me, this is the evolution of my adult life. I started policing, and when you police, maybe you're locking people up, you're arresting people, and you don't think about how that individual got in that position to begin with. You don't think about how could that have been prevented. what services could that person have gotten that would have changed their trajectory, their potential, and especially with young people. That's huge. You know, what is their potential that's not going to be realized because of something? So what's going on? How can we help them? And it's true for adolescents, it's true for adults. So that's how I viewed Nicasa is, okay, so look at the cause of why this is happening and then try to provide the services around, you know, those individuals and families to try and help them and solve that problem. So then you don't have this continuing. You know, Round Lake area did a great job with truancy years ago. Remember that?
Yes.
It was huge, and we had a very high rate of truancy. And the villages, police departments, Park District actually was integral at that time. They actually got a COPS grant. But, you know, what I learned from that is that, you know, there's a reason why, you know, kids aren't going to school. And there's a myriad of, but you know, a few of them just could be that, you know, in one case we had a family that had an issue with lice. And they just couldn't get ahead of it. They didn't have the help, they didn't have, and it's just something so, you think, boy, that keeps you from going to school, that keeps you, you know, that starts the fact that now you're not, you know, staying ahead of your studies, and now you're gonna fall behind, you're gonna have this issue. So I think that that concept of bringing people together, solve the problem, and try to, you know, look at the potential and trajectory for everyone that we come into contact with.
Great. Next question, please.
Can you tell us more about Teen Court?
Oh, well, it's funny the experts are asking me. So I'll tell you a little bit about Teen Court, and the first thing I'm going to say is that I know nobody's going to be surprised, but where did Teen Court start? Here in the Round Lake area. So it really is now about 22 years ago, and I had just come here as a police chief in Round Lake Park, and the chief of police in Round Lake Beach at the time, Ed Sindles, was probably the first champion of Teen Court, and the Round Lake area departments got together and decided, with Nicasa's help and Nicasa's, you know, thought process, and we had this wonderful woman, Julie Paul, who helped to start it. She had seen it in action in Texas and brought it here. And so we got introduced to it, and we started to look at, okay, here are these kids that in a normal situation would get arrested, probably be sent to branch court through the traditional justice system. And there's not necessarily a behavior change when that happens. So sometimes, you know, the adolescent in this case, or the parent, pays a fine, usually the parent. And there's not what we're seeking with our youth is a change in their behavior. So Teen Court looks to apply balanced and restorative justice, so a way to make it right with the victim, and have a behavior change learning component with the individuals that are involved in Teen Court. They have a wonderful relationship with the police department, because the police department actually does the referrals to Teen Court. So we can't exist, Teen Court can't exist without the police department. And in Illinois, we're the largest facilitator of Teen Court in the state.
Wow.
So, which is, you know, it's fantastic, but I think the end thing is that it works. So we check recidivism rates of our youth offenders, and we know that it's almost like a 75% reduction in recidivism. Wow. For the individuals that go through Teen Court. That's significant. What it tells you is that you know, when you have to own up to what you did, and you have to realize that somebody was hurt, and it doesn't have to be a person. It could be the school. It, you know, certainly could be parents. It could be, you know, anyone. But how do they make it right? And the creativity that our, you know, volunteers have, and they're all, you know, teens themselves, is out of it's out of this world. Things that I would never think of as a creative sentence are actually imposed on our youthful offenders. And there's about 1 million examples I could tell you, but it's creative, it's meaningful. It's not, I was a Marine, so breaking big rocks into little rocks, or filling up sandbags and then emptying them out and filling them up again. It's something that is meaningful. It often gets to the passion of that individual who was an offender. And what I love is that those that offend often become volunteers for the court and end up being that peer role model and mentor for the next kids. It truly is an amazing program. And I remember when it first started, and you kind of cock an eyebrow and you go, okay, how's that going to work? And then you see the change in the dynamics with the family. We have volunteer attorneys in the communities that volunteer as judges. And then the actual attorneys and all the staffing is done by these volunteer teens. And the care, the concern, the confidentiality, it's amazing. We've never had an incident. It's just absolutely a behavior-changing program for these kids. And how I look at it is, it's prevention, because if you can help these kids, and I'll be fully honest, I was a less than perfect child, and I actually got brought home by a police officer. And ironically, years later, I tested for that police department. I got hired, and I replaced that police officer. I got his star, his badge. He left me a whole bunch of stuff in his locker. He went off to Arizona. But I thought, wow, somebody's sending me a message here that he had an impact on me when I was a very young child. But that's the behavior change thing. Of course, my dad had a little help with the behavior change. But this is it's a great program, and I hope this is going to be appropriate. I would love if one of the teen court volunteers could talk about just maybe 1 or 2 sentences, creative sentences that they've had that have been impactful for the kids that have come through teen court.
That's a great idea. Would you guys mind sharing?
This is a surprise, so.
Yeah, so one time I think we had a kid come through, and when we're doing the questioning, one of the things that we always ask is, what are your hobbies? What are you interested in? What are you involved in at school? Just to know the defendant, so we can better create a sentence for them. And one of the kids was like, I like building with my hands. I like being hands-on and doing projects, and it was really neat. So part of his sentence was, I think we had him do, was that the car one, Nancy, or was that the? There were 2 of them. There was the one that came here to the village. Do you remember the one you presented, the popsicle stick house? Yeah, we did a popsicle stick house, and like written on the sides of the house was like good behavior, right? One of them was positive things. Yeah. Positive things in your school. Mm-hmm. Yeah. Because he damaged his community, parts of buildings, and part of the community that he was a part of when he committed his offense. As part of his sentence, we said, well, how are you going to repair that harm that you did? How can we fix this? How can we change your view of your community? And do it in a way that speaks to you. So we had him build a house out of popsicle sticks, and on that sides of the house was, positive things about his community and things that he liked. And it just showed him that, yes, he made a mistake, but he doesn't have to be that way anymore. And there is that positive change in his life and in his perspective. And I think that's a really great part of teen court, because whenever we deliver a sentence, we always say, please do not view this sentence as a punishment. You harmed the community when you committed your offense, and by completing this sentence, you'll be repairing that harm. And so it's really that way to repair what they do, and just show them that they don't have to be stuck in the decisions that they're making. If they're hanging with a bad group of people, if they're being peer pressured, if they just don't see a way out, the sentences that we give and the life skills track course that we have them go through, the doing jail tours to open up their perspective, see where they could be going if they didn't have teen court, if they didn't have this second chance to really fix themselves. Yeah, the way that we're able to do that, I think teen court is such a valuable part of our community, and that we're able to empower these people empower these adolescents who are in a time of their lives where they're going through so much change and they're so like volatile and very easily influenced, whether those influences be good or bad. It's that time, teen court is that time for change, time for intervention and early prevention. And the best feeling is when we have a defendant and then maybe a couple months later they've completed their sentence and we're like, they show up at our court and we're like, what are you doing here? And they're like, I'm volunteering to be a juror. And so seeing that change from being the one that we're talking to, giving that sentence, and now they're on the other side of the bench. Now they're sitting with us and helping other kids change their lives. So not only is teen court for teens, for kids, by kids, it really works. And yeah, we see that in not only our creative sentencing, but we see that in the way these kids change themselves. It's not just to make ourselves feel good, but it's to empower the defendants themselves to make positive decisions for their lives.
Mayor, I think I need to change positions. I mean, that's so perfectly said. And you know, we had one young lady in the Round Lake area that had an offense, and she wanted to grow up to be a beautician, hairstylist, etc. And so cool. Mario Ciccocci came in and they help individuals get ready for, you know, prom and whatever. So they're doing that. Well, the sentence for her was to work and help and work with Mario Ciccocci's staff. So she got a understanding of what they do, how they do it, et cetera. At the end of it, of course, they made her up too. So the impact of that, it's not just a nice story, that's something that's impactful. She gained an understanding of what she did, you know, admitted that, tried to make it right by helping all these other kids, and put herself out there to do that, and then, you know, got a little reward in the end. But that's so creative. You know, when you can do that, I remember when I misbehaved as a young person, and I remember in 5th grade I wanted to be a safety patrol. Remember that orange belt? Yeah. That's the starting of wanting to be a police officer, I guess. But I really wanted to do that. And I changed my behavior in order to make sure I could be a safety patrol. They probably felt sorry for me and gave it to me and hoped it would change my behavior. But it does make a difference. And you know, personally, and then I've seen it with these kids. And it's something that you can't do in a traditional court setting. It's something that the creativity that, you know, their peers have is just, it's amazing. And of course the staff is fabulous too, but I really have to give the teens the credit. They have, you know, it's just, it's taken very seriously, and, you know, as it was said, it works. So just a wonderful program, and it's really something that we're looking at actually this year to potentially expand to other regions of the county. You know, obviously money is always an issue, and it's interesting that, in my opinion, this is the kind of thing that should be funded. We started the conversation to talk about, you know, how to keep people potentially out of jail and out of prison. Well, this is a little bit it, because along the way, they have some offense that they've committed. They've come into contact with the police department. Police department's not seen as an enemy. The police department's trying to help them. And then now they're involved with Nicasa. We have these great teens that care for them. But then if there's additional needs that they have, we provide those too. So if they're struggling with substance abuse or they're struggling with something else, we can help. If their family needs assistance, we can help there too. And so it's getting to that cause again of a little bit of the problem. So I think Teen Court is one of those programs that's kind of a no-brainer it really has an impact, and it has an impact on the volunteers too. We have 3 scholarships that we give out annually, and one of them is actually named after Chief Ed Sindels. But it's also a way that we can, award something to our wonderful volunteers as well that really make a difference in these young people's, lives. So.
Yeah, the way you kind of talk about that, it seems like the court system is more of a logical, whereas here they reach the kids emotionally, and that's how they can help to change them and make them understand.
Yeah, and I think we're able to take more time, and provide more resources. And, we have the parents come, and it's really it's not like a get in, get out kind of a thing. It's what do you need, and sometimes the sentences take a period of time for them to do.
Oh yeah.
And some of them are would be considered very difficult, much different than, like I say, paying a fine, or maybe worse yet, having the case thrown out and kind of reinforcing the behavior for individuals. Well, hey, I got away with it. So this is a way to truly make a change and a difference in a young person's life. And as I shared about myself, that's important. And I've seen countless kids in the Round Lake area that needed that help and then got it through teen court.
We're getting close to the end of the program here, so maybe we'll open up for some questions. Does anyone in the audience have any questions for Bruce? Yes.
I'm interested in your position on recreational marijuana.
Yeah, and I'm sorry.
Maybe repeat the question.
So, question was my position on marijuana, recreational marijuana, and I think that's a really timely question. So, the research that's out there tells us a lot about adolescent brain development and alcohol and marijuana. I think there's somewhat of a perception that marijuana is this harmless drug, and it's not. There are lots of consequences for young people who actually use marijuana, and we're seeing that in many states where they may have started with medical marijuana and now have gone to recreational use. We're seeing a spike in fatal crashes involving marijuana. We know that an adolescent under 21 that uses marijuana is twice as likely to end up in an accident. And again, I made it through a 26, 23, and now a 17-year-old. Young people have enough problems, certainly driving without the marijuana being used. There are long-term effects to marijuana usage. Mood, psychosis. There's actually a IQ drop for individuals that use marijuana regularly, and it could be up to 6 points. Wow. And speaking as somebody that needs every IQ point I have, that's significant. So, I talked a little bit about potential and trajectory. Marijuana retards your maturation. So if you start using marijuana regularly at 14, 15, or 16, you're going to stay at that emotional intelligence level of a 14, 15, or 16-year-old. Physically, biologically, you're getting older, but mentally and emotionally, you're not. It absolutely changes their trajectory and potential for higher education. And I think all of us that have kids want your children to do better than you did. You want them to succeed. And I think it's really a huge concern for all of us that the fact is, the more marijuana you bring into Illinois, the more access there's going to be for kids and for young people. So that's just a fact. The more incidents of our youth and adults going to hospitals for emergency room visits. And then probably the most significant thing, and I've heard this from parents many, many times. I've been on a number of panels, and we're talking about heroin and opiates, and we talk about the gateway that alcohol and marijuana are for heroin and opiates and other drugs. And I can't tell you how many parents I've heard say, my son or daughter on weekends was experimenting with alcohol and marijuana, and the next thing they say is, I wish I would have done something then. A lot of parents don't think it's a big deal. Marijuana as well as opiates, there's receptors in your brain, and when those receptors get a hold of those drugs, there's certainly a euphoric feeling, but there's also, I have to have that feeling. And unfortunately, for those that are dabbling in alcohol and marijuana, unfortunately, there's a much greater potential for them to use other drugs, including heroin and opiates. And that's a huge problem today. And what we see today is, I know all of you, read the papers and you look at, kind of some of the deaths that have taken place with heroin and opiates, and the mixing of fentanyl and carfentanil, with heroin, and just how almost instantaneously this couple of, minute, particles of fentanyl can actually kill someone. There's some really good graphics that would show you, okay, here's an amount of morphine, and here's an amount of fentanyl. It's such a tiny amount that can lead to your death. And the drug dealers and those that are distributing, it's not a pharmaceutical that's mixing this, right? So one batch you get this much, one batch you get this much, and that means the difference between life and death. So I think that parents have to think hard about what their kids are doing, who their kids are with, know where your kids are, know not just the kids that your kids are hanging around with, but know the parents of those kids. Ask some tough questions. I always say, I was a Marine and in law enforcement, always had guns and firearms. I've never had a parent ask me, do I have guns or firearms in the house? Certainly they've never asked me if I have illicit substances in the house. And only on occasion have I had somebody say, is there going to be alcohol present, when kids are over? Those questions are really important. My father-in-law always said, nothing good happens after midnight. So sleepovers and all those kinds of things may not be the best choice, for your kids. And you can't afford to be, a popular friend to your kid. You have to parent them, and we do these programs. We actually run a drug-free communities grant in one of the communities in Lake County and in Mundelein. And, the prevention specialist, the coordinator, everybody I've heard nationally, the most influential person on, young people is their parents. They are the most influential. So you gotta have the discussions, you gotta talk about it, because quite literally, it now means the difference between life and death. Marijuana today is not what it was, when I grew up. The potency, and they keep finding ways to make it more and more potent. It's 4+ times percent, times more potent than it was. The THC content is really high, and the delivery methods that kids are using makes it that much more potent. It is seriously dangerous. So I know that, I'm not the smartest guy, but I know that, taxes on tobacco have not paid for the societal costs of tobacco, smoking, cigarettes. I know that taxes on alcohol have not paid for the societal costs of alcohol. I am 100% sure that taxes on marijuana are not going to pay for the societal costs and truly our kids and their futures and their lives, their cost. And I wrestle with this because I am very concerned about the access for our kids. I'm concerned about, we do Illinois youth surveys, 20,000 plus kids take that throughout the county. And we look at trends and we look at data. And my concern is that there's a norming of marijuana is okay. It's safer than alcohol. It's something that's natural. It's not true. And it is something that's very harmful to young people. We know more about the adolescent brain and its development. We know the effects now of alcohol and marijuana. Parents need to educate themselves, and they need to work from facts, because I know a lot of kids will read the internet and they'll have 10 quick responses to whatever a parent says about in this case marijuana. You have to get the facts, you have to understand what's happening in these other states, and you have to look at scientific research that says, look, you're more likely to be using heroin and other drugs if you smoke marijuana regularly. And the younger you start, the more you have a chance of doing that. So that's a key factor. And I think also that there's a lot of argument about rites of passage and we'll do it in a controlled environment. I got to tell you, as a lot of years in law enforcement, and we actually just honored a police officer for his investigations of sexual assaults. I can tell you that by and far the vast majority of sexual assaults, alcohol, marijuana, and drugs play a role in it, especially with our youth. And that goes both ways. It's not just the girls who are victims. That also is something, having two sons, those were conversations I had to have with my sons. This is, if there are risky behaviors, if there are accidents going to happen, alcohol, marijuana, drugs play a huge role in it. So they really have no place in our young people's lives. So I'm very concerned. I try and watch what's going on. We speak out about it. There is some work that's being done statewide, but it's an absolute concern, and my concern is for our youth. I know access is going to be, and I know there's been a lot of investment in it in this state. So I know access is going to increase, and unfortunately, more marijuana is going to get to our kids, and I do unfortunately know what the effects of that are going to be, and it's not going to be good. And we need to look at some of these other states. How do you employ somebody that can't pass a drug test? How do you do that? In one state out west, they're actually bringing people in from another state to work. You can't operate heavy equipment. You can't. There's so many things you can't do. Somebody was telling me that they actually couldn't hire enough people that would pass a drug test, so they just cut that out of the application process. So what we've done, now imagine if that's a lifeguard, a teenager that does his job, right, or her job. They get hired, they're smoking marijuana, using marijuana, eating marijuana, and that's their summer job, and now your kids are at that pool and they're not testing them. I mean, is that where we're going? So my concern is absolutely for our young people, and what's going to happen to them. And like I say, we watch the trends, and what we've seen is there's a perception of harm that's actually gone down. So parents, as well as the kids' perception of their parents, think that it's not as harmful. That's dangerous, and it also tells us that parents aren't talking to their kids about the effects of alcohol and drugs. And there's a lot of communities, and we're in them, where the majority don't drink and don't use. We want to build on that majority. We want to make sure that that's the case. And parents don't throw up their hands in middle school or high school and say, well, everybody does it. That's not true. And there's a lot you can do to ensure that they don't use. So, and if there's an issue, they need to get help. The earlier they can get the help, the better it is for them.
Well, Bruce, thank you very much for coming out today.
Gosh,
really
thank
appreciate
you.
it.
Thanks,
now we're
Mayor.
by very quickly. I know one of our village pins for you. I
You're
hope you
wonderful.
wear with pride.
Thank you very much.
And will you stick around for a few minutes in case there's other questions?
Of course.
Great.
Thank you for this opportunity.
Big round of applause for our Nicasa.
Yes.